Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil, and the babies are too. See, that's a little chicken there. A week old today. So try to keep that one quiet for us.
What's old and new in pain relief medication? What is the
On, Ja-
new non-opiate treatment for moderate to severe acute pain?
on January 30th, 2025, the Food and Drug Administration, FDA, approved Jorvx, and that was a 50 milligram tablet, oral tablet to treat moderate to severe acute pain in adults.
How does Jorvx work?
There are sodium channels responsible for the transmission of pain in adults. And the sodium channel is in the pain pathways before it gets to the brain. So that's where it stops the pain before it gets to the brain.
Is Jorvx a narcotic?
No, it's the first in class new non-opioid analgesic.
What kind of pain does Jorvx treat?
It's said to treat acute or short-term pain, typically in response to some form of tissue injury like trauma or surgery. Acute pain has been treated in the past with sometimes opioids and sometimes not with opioids.
Why does the FDA hate opioids so much?
The FDA is under the mistaken assumption that taking 5-oxycodone tablets will make you addicted, want you to live in the streets, shooting up morphine and snorting fentanyl. And it's a great way to criminalize legitimate medical care.
Has the American College of Obstetricians and Gynecologists released new guidelines emphasizing proactive pain management in the office?
They certainly have. The ACOG recommends something they call proactive pain management for common in-office procedures, including IUD insertion, endometrial biopsies, and hysteroscopies, which is when it's a device you use to look inside of a uterus.
Does these new recommendations surprise you?
There's nothing coming from the ACOG that really surprises me. What does surprise me about these recommendations is that they are about 50 years too late. This is like Rip Van Winkle on Valium. We were told in medical school and residency that women couldn't feel pain in their cervices, so there was no need to anesthetize the cervix. My concern is that there might still be people around who actually believe that the cervix can't feel pain and still perpetuate that misunderstanding. When I was a resident and student, I only needed to see one clamp put on a cervix to understand that was something I would never do without anesthesia.
ACOG also recommends shared decision-making and individualized care. Can you tell me about this?
Shared decision-making means having a conversation about choices. The individualized approach is based on the principle that pain is subjective. Therefore, pain management planning must be unique to each situation, including age, trauma history, and anxiety levels.
All right, the best place to go is worlddocallen.com and pick up Pregnancy Your Way, available today on Amazon, and also say hello to Doc's bird.
We call this chick, but don't read anything into that. It's short for chicken.
All right, that was a chicken, everybody. that was the World Doc Allen podcast, guys. Take care.